They're very tricky. So there's 3 different ways they can impact the immune system. They can actually impair the genetics of your immune system so that you stop making smart antibodies. And what we see a lot with like Epstein-Barr virus, the whole herpes family, it's very common to have those be chronic and recurrent in people who are exposed to mold because they are, and a lot like Lyme too, they are particular microbes that rely on the immune system remembering so that when it sees it, it's like, oh, right, I know about you, and here's how we take care of you. Lyme is very important that way, that you don't like cure Lyme out of a body. Basically, the body puts it in a jail. That's a good way to think of it. So any infections like that, where we have to keep it in jail in our body, mold will change your immunity.
Hi, and welcome to the LymeBytes podcast, where we shine a light on the misunderstood science of Lyme and other vector-borne diseases, as well as the truths that many still miss. I'm Dr. Mariah Hinchy, naturopathic physician and fellow of the Medical Academy of Pediatric Special Needs. I specialize in treating chronic Lyme disease as well as other complex inflammatory conditions. In this podcast, we break down what's working and what's not. We share the facts that most people miss, we challenge outdated thinking, and we give both patients and practitioners the tools to heal smarter. So let's get into it and change the way we heal Lyme. Today on LymeBytes, I'm honored to welcome not just an expert, but a dear friend, Dr. Jill Crista, a leading naturopathic doctor, educator, and author who's helped thousands unravel the mystery of mycotoxin illness. Her work has truly changed the game when it comes to identifying and healing from mold-related conditions. And I can say that personally, having completed her mold certification course, which was absolutely brilliant and packed with clinical insight. In this episode of LymeBytes, Dr. Crista breaks down how mold and mycotoxins disrupt the immune system, hijack our health, and mimic or amplify complex chronic illnesses, and more importantly, how to find your way back to health. If you've been sick without answers, this conversation could be a breakthrough. Get ready to challenge old models, embrace a functional root cause medicine perspective, and uncover real hope for healing. This is LymeBytes. Let's dive in. Welcome, Dr. Crista. Thank you so much for joining us today. Let our audience know a little bit of how you chose to specialize in treating mycotoxin illness.
It shows me. I was working with chronic Lyme patients, and acute, of course, but that's how I started with the Lyme world was, an acute Lyme case, and then I didn't know how to treat it right. So then it became a chronic Lyme case. And then it was like, oh, I wonder if these other people, it's actually Lyme. And then, away we went. And when I went to the iLads physician training, I got really comfortable with a bigger toolbox, getting more comfortable with antibiotics and that kind of thing. And it's amazing. Like when you find and treat the cause, people tend to get better. It's incredible.
A novel concept.
Yeah, wow. Yeah. And so here I was finally having this success, at this thing that I had missed before, because as we know, Lyme is the great imitator. But then there was this subset of people that still weren't getting better. And in one of those patients, they found toxic black mold during a remodel. And that was the Pandora's box opening for me, was like, oh, I don't think I understand all the things mold can do. And I just hit the books, hit the research. And there's a ton of animal research. And realize that, like, where's all the human research? And realize as I'm reading these, like, mycotoxins that are made from mold can cause birth defects, they can cause cancer, they rewire the immune system. And that's when I realized we're never going to have those studies because you can't, medical ethics, thankfully, dictates that we can't say, hey, who wants to sign up for a study where we're going to poison you? And then we're going to give you milk thistle and it should be okay. It should work and we'll see. It works in animals, but we don't know yet. It was kind of like, we're never going to get those studies. So I just took the reins. I was like, well, I'm not going to wait for a randomized clinical control trial. I'm a naturopathic doctor. I have a lot of comfort with these things like milk thistle, turmeric, all of these things that are giving animals.
Yeah.
Kind of know the human doses. Let's try it. And people started to get better. And so that's where, and then, in the Lyme community, somebody gets better, they tell people on Facebook and, this is even pre-Facebook, um, in the communities of like, go see this lady. So then I had the situation of people flying in from all over, even Ecuador to see, get treated for mold. And then, you tend to get a repetition
Right.
success. There's just when you see enough patients, you see the trends of what's working, what's not working. And I knew the things that I could throw away that I thought were going to be good, but ended up not being good. And then kept hitting the books to find new things. Like who knew grapeseed extract would be good for mold? Like
Right.
I wouldn't have known that till I found an animal study and I was like, well, let me try it. And lo and behold, their mycotoxins started dumping out of their kidneys faster. It's like, okay. Like I was just trying stuff. And that's how we got here.
How long ago did you start treating mycotoxin illness?
2000, the remodel I think was in 2007. That was the big like,
Okay.
oh, so 6 or 7, something like that. Yeah. It's
Yeah.
about 20 years.
So, for those who are new to this topic, can
Yes.
you explain what mycotoxins are and how they differ from mold or just a mold exposure or a mold allergy?
Yeah. So mold can make us sick with a few different ways. So the spores themselves, and those are what a lot of people have allergy symptoms to, and then the fragments. So the fragments are when a spore dies or breaks apart, and one spore can cause 300 to 500 fragments. So if we think about mold, a 1-inch square of mold is a million spores. And so if you go in and you're like, "Oh, we have mold in our carpet," and you try to tear it out without containing it and everything, you've just released many, many more fragments, and those are really hard on the lungs. They're kind of like asbestos that they can kinda lodge into the lung tissue and permanently irritate them. So we have spores, spore fragments, and then living mold spits out all of these chemicals. So that can be anything from VOC. A lot of people think of VOCs from new materials, but microbes make them too. And that can also be alcohol. So some people can actually get kind of buzzed feeling when they're in this an environment where there's actively living mold because they're spitting out this alcohol and you're taking it into your body. So you can feel maybe a little bit drunk from breathing this moldy air. But then there's this other fourth thing that is the mycotoxins. And those are made by mold on purpose, not all the time, to compete with other microbes in the area. So if they are starting to sense that another microbe wants to come in and enjoy its humid spot, I kind of joke that it's lakefront property for mold. It's like humidity, this is my favorite,
Yeah.
and a very, very little bit of humidity. Mold can grow at over 50% humidity. So, in like New England, where I am in the Midwest, like Pacific Northwest, Florida, coastal zones, you're dealing with way more than 50% humidity. But so it really helps mold if we water it and we keep our indoor environment humid. So it'll move into a humid environment. And if it knows that there's another mold spore there, it'll start making this chemical to kill the other microbe. And that means they're super lethal. And that's exactly what happens to us as well. We're not the target, but by being in that environment, it has all the same biological harm to our bodies as it does to that other spore. So it's mold spores, mold spore fragments, mold chemicals when it's growing, and then mycotoxins when it's feeling competitive. So if there's a mycotoxin in the area, there's another mycotoxin because the spores are going to be competing. Yeah.
So there's often more than one species of mold present that are making the different types of mycotoxins.
Yeah, and that's the trick. And so in my patient population, even before I was, the mold lady, I was seeing just like chronic Lyme, mold allergy accounted for anywhere from 5 to 15%, usually around 10% of the symptoms. And that's going to be your spore reactions.
Yep.
Spores induce mast cells and histamine like nobody's business. They are very, very good at that. So that's going to be respiratory stuff. And this is what the CDC recognizes as mold illness. And then if you're really immune depleted, it goes all the way to the other side of aspergillosis. So that's when the fungus is actually coming in, it's invading, it's infecting. But in my patient population, there were 80 to 90% of symptoms that are not accounted for from the spores.
Right.
And that's the mycotoxins. And that's going to be things more in the range of toxin-based symptoms versus allergy. And I can go through the kind of the typical cluster if that's helpful.
Yeah, I think that would be great. And something that I also want you to address, because I know that this is the most baffling piece and almost makes the diagnosis feel disbelievable to family members, is why you can have a family of, say, four,
Uh-huh.
and you have a mother who is completely neurologically impaired and the father has no symptoms, and maybe one child has a cough and then the other child is pretty much fine. And
Right.
so it's like this disbelief that one person can be so impaired
Yeah.
by something that they cannot see, smell, taste, it
Right. Right.
cannot sense its presence whatsoever, and one person is debilitated while other family members have hardly any symptoms. Are you ready to revolutionize your approach to diagnosing and healing complex chronic inflammatory illnesses in both adults and children? The LymeBytes Symposium is your gateway to cutting-edge education, groundbreaking research, and innovative therapeutic solutions. Join us at the 2025 LymeBytes Symposium, November 14th and 15th at the Fort Lauderdale Marriott, Pompano Beach Resort and Spa. LymeBytes is the premier functional medicine conference on complex chronic infection-driven inflammatory illnesses. This year's meeting is jam-packed with leading industry experts discussing long COVID, mycotoxin illness, PANS pandas, as well as Lyme and other vector-borne diseases. This conference will arm you with the knowledge, clinical pearls, and practical solutions that you can implement immediately into your practice Monday morning that will literally change your patients' lives and get them on their path to true healing. So join us at Pompano Beach or virtually from anywhere. Register now at lymebytes.com. That's LymeBytes.com.
Yes. And that is more normal than it is the exception.
Right.
That tends to be the rule, not the
Yes,
exception, where everyone
exactly.
reacts differently. And this has to do with a lot of factors. So I have identical twins. So same genetics, same house, same diet. I was making all the food, and their symptoms were different. So it's not even just a genetic thing.
Right.
So it is genetics for sure that some people are pretty crappy detoxifiers, they're not good at getting toxins out. From my perspective, it's much less about the HLA expression, which we hear a lot about, the 25% of people have this, this gene. For my practice, it's much more related to how good are you at detoxing? And then how toxic are you already coming into this exposure? So if you
Right.
have already amassed a lot of toxicity, you're going to be more sensitive. And we learned this from animal studies too. People who are higher in DHA, their cells were more protected. So the DHA is a fish oil for those that are listening. And what it functions as is a structural component of our brain and nervous system. In animal studies, if there were mice that had more DHA in their brain and nervous system, it actually bumped the mycotoxins off the membrane. It was like, no, 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 you can't come in here. So it keeps the mycotoxin in the bloodstream so the body can detoxify it better. We see if you're lower in reduced glutathione in your tissues, in your mitochondria, then you're more affected than an animal. We're animals that didn't have that much. Bioflavonoids. So there are these certain nutrients that can lead someone to be more susceptible. So it's genetics, it's diet, it's your previous exposures, not just to mold, but to toxicity in general. So how high is your cup filling up? And we're
Mhm.
all given a different size cup when we're born. So for some people, a little bit of toxicity is going to spill over into symptoms a lot sooner than someone who is like one of those super detoxers, people that can drink, smoke, go to McDonald's, they're just like, and they're fine. They sleep great. They poop every day. It's just like,
Yeah.
what are you made of,
Yeah.
So, yeah, that's a big piece. Also, who's closest to the mold? Who's got the vent right by if it's in their furnace and the vent is coming down onto them while they sleep? Who's got the mold right on the wall where the head of their bed is? Who's got mold at school also? So is getting a
Right.
double whammy exposure. Find in a lot of families the person that's most affected when we bring in, the inspectors or the mold dog or whatever, they're the ones that are closest to the most toxic mold. Even if there is less toxic mold in other places in the house, the ones closest to the toxic species tend to be more affected. So lots of things can play into it. The biggest thing in our research, Dr. Neil Nathan and I have a research project going on right now to validate the clinical questionnaire that I developed in all of these years. We're finding that previous or known exposure, but previous exposure is one of the most key problems or symptoms or whatever that's going to make you a mold sick person. So that goes back to that colonization thing. Like if you had
Right.
a bad exposure before and it has changed the microbiome of your sinuses and your respiratory passages, um, that's going to make you a much faster responder to the next exposure.
That makes
Yeah.
sense.
I mean, it does. I mean, it's, although, we'll talk to EENTs who say, you can't, everyone has fungus in their sinuses. What's the big deal? And
Right.
I agree with them. Everyone has fungus in their sinuses. The big deal is, according to Dr. Brewer's study, which blew my mind and completely revolutionized how I was treating, um, that the ones that are sick, and sick from a water damaged building, those spores aren't just things you breathe in and you breathe back out again. They become residents. And when they're being residents, they're not good neighbors. They're making mycotoxins. So if we tested healthy people and sick people made sick from water damaged building with chronic fatigue, which was what his study was, they
Hmm.
sampled they sampled sinuses, lung, gut, brain, sampled all these tissues. And lo and behold, everybody had fungus up there in their noses. But only the sick people did they find mycotoxins. And so that's, I work with a really talented EENT, Dr. Donald Dennis in Atlanta, Georgia. I sent a lot of patients to him. And the very first patient that I sent, he had sinus symptoms, but you don't have to have sinus symptoms to have sinus colonization. And that's what blows everybody's mind. But this guy did. And so I was like, I think you need this surgery. And he has a cyclone machine that like sprays in itraconazole and then sucks it all out again or whatever. But he had to take a fungal ball out of this patient first. He puts it on the sterile cloth, and that fungal ball a half hour later had made mycotoxins. It was still making mycotoxins even out of the body. So
Wow.
you think, and this patient had like Parkinsonianism.
Yeah.
He doesn't anymore. He's perfectly healthy now, you know,
Wow.
and he wasn't able to walk without a cane before that. And it's like,
That's amazing.
why wouldn't we treat that? You know?
Right.
And that's what
Right.
ENTs say, that I overdo the treatment, and I'm like, why wouldn't you get rid of that? Those are right by your brain, you
Right.
know? Yeah, incredible. I mean,
It
I have
is
story after
incredible.
story after story about success stories, so I hope anyone listening, if you're getting worried or scared, I cannot tell you, it's rare to not have somebody do better,
Right.
so just stick with it.
It's great advice. Okay, so let's take a step back because I got us
Yes.
ahead of ourselves.
Yes.
So please tell us the symptoms of true mycotoxin illness versus like a mold allergy.
Yeah, I think most people know what an allergy feels
Yeah.
like, right? You get exposed, you start sneezing, you get itchy, and your eyes water, and your throat scratchy, and your lungs might get irritated. There's a lot of cases of asthma that started with a mold exposure, and there again, I think lungs get colonized. So
Hmm.
that's like the allergy side. So for an adult, it looks a little bit different than a kid. In a kid, they're going to respond first with more skin stuff because they're little sponges, and we can take these mycotoxins in through our skin. So they'll have a skin thing before they have their brain go off. So, whereas an adult, typically it's going to be brain fog, fatigue, um, that the idea of just like your brain literally runs out of gas, and visual problems as well. Kind of feels that way, that you have trouble comprehending, you have trouble reading, and the eyes can feel like they just literally run out of fuel, and that you just need to like, I just need to close down and shut down for a little bit just so I can, rest my eyes almost. Ear ringing is very common with mold. So I'm just going top to bottom.
Yeah.
Headaches, we can see headaches. Of course, sinus and allergies. So don't rule that out. If you're like, oh, she didn't mention that with mycotoxins. If you have mycotoxins on your nose and in your sinuses, it's going to irritate stuff. So you'll get more reactivity. Um, You can see irritated lungs, as we were talking about, any kind of skin problem. Now, in grown-ups, that tends to happen after the brain fog, whereas in kids, it's gonna go the other way. But whatever your skin thing is, if it's acne, it's gonna make it worse. If it's more aging, it's gonna make that worse. So it just takes your Achilles heel of your skin and goes with it.
Yeah.
Gut problems are very common. So irritable bowel, SIBO, so small intestine bacterial overgrowth, because the mycotoxins change the speed of our peristalsis. So the squeezing of the tube of our gut, it'll slow those things down. And then you can get bacteria moving to places in the gut it's not supposed to go. A lot of times we'll see bloating, food reactions. There might be food reactions to histamine containing foods like leftovers. That's a really common one, or broth, things that are cooked for a long, long time. And then another really odd one is pelvic pain. That is really commonly a mold problem. And the reason is that we detoxify these a lot through our urine. And if the urine is there too long, those mycotoxins will just move into the nervous system of that area. And when mycotoxins are there, they ping. They just continuously ping the nerves. That's why ear ringing is common. Because if you're breathing them in through your nose and sinuses, now you get a buildup in that area and it just pings the nerves. And so you get constant ringing. So pelvic pain and ear ringing, visual problems, fatigue, messed up gut. I'm like, we need to be talking about mold. Yeah.
Yeah.
And in kids, we will also see, also grown up, so kids will display this a little faster, is urinary frequency. Because the body knows, oh, there's a toxin there, so let's get rid of it. It's really smart, right? But
Right.
it's inconvenient if you have a kid who can't go to the bathroom other than at recess time. That can be really a problem. Some kids actually refuse to go to school because they don't want to be embarrassed from having to pee all the time.
Yeah.
Yeah,
So when it comes to like a family, right, that's all being exposed and we have these varying degrees of response from the body, it's just as dangerous for everybody to be living in that environment, right? It's not just the person who, because they have other genetic or structural or, environmental hits against them, right?
right,
It's equally as dangerous. And a lot of these mycotoxins can lead to cancers
right,
and other debilitating neurological diseases down the road that are more chronic and we're just going to, get explained away anyways. Like
right.
something like Parkinson. Are you suffering from Lyme disease or another complex chronic illness and aren't sure who to trust when it comes to herbal supplements? Hi, I'm Dr. Mariah Hinchy, founder of LymeCore Botanicals. As a naturopathic physician specializing in complex chronic infection-driven illnesses like Lyme disease, I needed herbal medicine I could truly trust. That's why I formulated LymeCore Botanicals, where our herbal tinctures are handcrafted in small batches right here in Connecticut. We use the whole herb, never isolates, to preserve the full spectrum of medicinal compounds. Every single step from sourcing to extraction is done with precision to ensure maximum purity, potency, and consistency. These are the same herbal formulas I use to heal myself and have used for years to help my patients and family members heal too. And now I'm making them available to practitioners and patients everywhere. LymeCore Botanicals, herbal medicine you can trust from a doctor who lives this work. Learn more at LymeCore Botanicals. That's LymeCore.com.
Yep. Yep. And Dr. Bredesen talks about inhalational Alzheimer's. This is linked to breathing in mycotoxins, and they go to the brain. So the person who's not reacting is just not reacting yet.
Right. Right.
Militaries around the world use these mycotoxins for biowarfare. They wouldn't do it if it didn't impact everyone. So it's a matter of dose, duration, which mycotoxins, some are more toxic and potent than others. And so when usually it is the dad who's not the reactor. And that just has to do with like the more body fat you have, the more you can take on these toxins. And, that no judgment on dads. It's just your
Yeah.
biology and say thank you.
Right.
And also testosterone is an amazing anti-inflammatory. So, that That could be just that, they're able to handle it for a while.
Yeah.
However, when we test testosterone levels and we look at testicular function, we got a problem because a lot of these mycotoxins they're harmful to the testes themselves. They cause testicular damage. And so when we can start to see, like my long-term patients that I had, that were healthy and we were, just tracking. I always in men's health is like dear to my heart. Like there's a
Mhm.
reason God gave me boys because I just like a great. I'm a boy mom, and I'm always like, oh, you men, you're so forgotten by the medical system. So I had a lot of male patients that were, either working on like optimizing their VO2 max to, I've got a gut problem or hair loss or who knows what. So I noticed the patients that were having a new mold problem or they moved into a new house that had mold, their testosterone was tanking. And I was like, this kind of makes sense actually, because if the liver is busy working out the toxins, it's not going to get around to balancing hormones because the liver makes our hormones. But
Right.
then also, some mycotoxins are estrogenic. And so I was not only seeing their estradiol go up, I was seeing their testosterone tank. So that's what I ask dads is, will you fill out my andropause questionnaire? How is your test doing? And a
Mhm.
lot of times they were starting to get muscle mass wasting, trouble gaining weight, hair loss issues, erectile dysfunction. That is how mold can affect a man before it even shows up as like the typical toxicity.
Right.
Yeah,
That's important to think about.
very. And it's important also to address and treat because low testosterone is not just about sex drive. It's about
Right.
bone density. It's about brain health. It's about cardiovascular health. Like this isn't just about, oh, I couldn't have sex. Not that that's not important, but it's really important for the whole body. There's a reason why we have these hormones and it's more than more than a sex drive. Way more.
Way more.
Mhm.
So, how would you advise our listeners who have medical practitioners that they're seeing that say there's mold in every house, there's mold outside, we are all constantly exposed to mold. Your naturopathic doctor is crazy, for suggesting that mycotoxin illness be a piece of what's going on with you or your loved one.
Right.
How do you
Yeah.
counsel them to handle that sort of, because I mean it is true, right? It is true. There's
Yeah.
mold everywhere,
Yeah.
but how do you respond to that?
So the mold that is outside is part of nature. And so it acts more naturally. It has all these nature forces that keep it from acting out of a harmonious way. So it's got the mycelial network in the soil that is really the supreme intelligence on the planet. It is like it's connecting the trees, it's talking to is it going to rain, all of that is going on. And then you've got, UV light, you have wind, you have air movement, you have little insects that drink up all the dew in the morning and take care of the excess water. That's not happening in an indoor environment. So it's rare to find a mold to make mycotoxins outside. The only time it's doing that is if it is like in a swampy environment that has lost, it's gotten like an algae infusion or a chemical infusion or something like that.
Mhm.
Inside, we don't have any of that. So we have no wisdom. It's disconnected from its internet, so to speak.
Yeah.
And it's got moisture, its favorite, food and water, basically, and competition, wanting the same thing without air movement, without UV light, without insects taking up that extra moisture. So you've got a problem and it acts very unnaturally. It's not normal for mold to make the mycotoxins it's making. And actually, when they're trying to create it in a lab, there's a lot of old research about how to make these bioweapons. They have to add certain nutrients to a plate to grow it well enough to make it mad enough to make mycotoxins. Mycotoxins are incredibly energetically expensive for the mold to make. It doesn't want to do that. It wastes a ton of its resources to make these. So, but inside, if it doesn't have all of those forces, it will take the cost because it also has plenty of water and plenty of food in your house. Yeah.
So remediation, I think anyone that knows anything about mold, remediation is a very serious thing that has to be done appropriately. And so when I ask you
Absolutely.
this question, keep in mind I'm not asking you from a big, remediation standpoint. But if someone has like even a little bit of surface mold that they might see,
Mhm.
what would be an effective way to approach cleaning it up that isn't going to just kind of piss it off and make it
Right,
make more
right,
mycotoxins?
right.
So something that's effective in cleaning it, but isn't going to cause future problems because I know bleach can lead to problems. I'm pretty sure using like white vinegar is the best, but then there's all these other industrial mold cleaners. What, in your opinion, again, if it's small, if it's isolated,
Mhm.
what is the
If
way
it's
to go
non-porous.
on a non porous material? Right.
Yeah. Yeah, so of course, remediation needs to happen if you have any mold affected material that has any porousness to it at all. So that would be drywall, wood, anything that is not tile or concrete, basically.
Hmm.
That needs to be removed. That's the gold standard. Like it just needs to be removed. There is no such thing as dead mold. Although the inspectors will say, we tested it and it's dead mold. What that means is it's not growing little roots. It's not in growth mode, but that means that's a dormant spore. Dormant spores can regrow anytime the humidity goes back up about 50%.
Right.
So there is no such thing as dead mold. There is only a fragment.
And so an
Either,
important thing would
yeah,
be like when people say, well, we took it down to the studs. Well, unless your studs are made of metal, right? So, like if you have two by fours that make up the framing of your house, or if the
yeah.
sill of your house, is made out of wood, wood
Hmm.
is porous, and taking things down to the studs might not necessarily be eliminating all of the mold that's there in the home.
Exactly. Yeah, and we tested this in my own house. I was the perfect person for this to happen to because we tested every step. And there was one time where the remediators found in our basement, we had wood framing and they weren't able to come back for another 3 weeks. And I was like, okay, so what I want you to do is in this section, don't do anything.
Mhm.
It was my whole basement, so we had plenty of room to play with.
Yeah.
In this section, I want you to, treat it with essential oils, and
Yeah.
in the 'cause the I'm gonna say to you guys, "I see mold at the base of that sill, and
Yeah.
I want it out." But they're
Yeah.
like, "Yeah, we can't come back for 3 weeks." And then on this one, I want you to do your normal MSR, mold stain remover, which has no mold killing in it at all. All it does is remove the stain, by the
Okay.
way. And then we tested bleach. So and then when they came back in 3 weeks, they removed all of it, and we sent it for testing. The stuff that was left alone, um, what happened with that? Just stayed the same. The
Yeah.
essential oils did reduce the mold count, but there was still mold when we removed the sill and we turned it upside down. It had a bunch of black mold in there. You couldn't
Okay.
see it. There's a ton of black mold. The MSR and the bleach grew 2 additional species of more toxic mold. So we watered it, basically. And that's what
Oh,
a lot of these guys are doing. So if you can't access it to sand it off, like the bottom of the sill plate that was touching the concrete, that has to come out
yeah.
because it will just regrow.
Right.
This is a very tenacious creature we're talking about. So if it can be accessed with a sander, uh, they need to sand off
So it's
anything.
physically removing it.
Physically removing it is the only
Okay.
treatment, not fogging.
Yeah.
Fogging
Okay.
is a
So let's go.
follow-up.
Yes. So let's go back to a non-porous material.
Yes,
So you have a
non-porous
little
material.
bit of mold. It's on a non-porous material. What do
Yep.
we clean it up with?
Guess where the most common one is? Your toilet bowl. Your
Okay.
toilet bowl, that little pink stuff that grows if you are not getting around to cleaning your toilet, that's
Yeah.
most likely Chaetomium.
So
That
let
can
me
be a
ask
bacteria.
So let me ask you this. If you have I mean, can you tell a patient, like do you ever do this? Do you ask a patient what they see growing in their toilet bowl? And I mean, could that be a sign or would that just be coming from the air? Or do you think that would also be coming out of said patient who's peeing and detoxing into the toilet?
Right, it could be coming out any of those, but the
Okay.
one that is most interesting is the tank. If there's funky stuff in your tank, that's a mold problem somewhere in your house. It
Okay.
found the new lakefront property. So toilet tanks, it like people need to be watching those because that can be an early indicator. You're not adding your own biological material to the tank, but you
Right.
are to the bowl. So the bowls did, but I was just like giving an example of like it can be very easy to clean if it's a non-porous material. But yeah, watch your toilet tanks, everybody. So
Hmm.
if it's just like, let's say, like when I was in Hawaii, the tile would get a little overspray, in the shower, and then within the day, it would grow mold because it's just so humid there, and that's tile, so that's not the grout. Grout is a little tricky if it's not, sealed and all of that. But this was
Hmm.
tile, and you could just use thyme essential oil. There are products that are using this. One's called Benefact or E3C. Um, Thyme is wonderful because it prevents the mold from making mycotoxins to defend itself. So that's one of the things we know when you're going to go after mold, it'll start to make this because it's a bioweapon, right? So it's like,
Hmm.
oh, I'll defend myself and I'll make all of these mycotoxins. Well, thyme stops it from being able to do that. And it's antifungal. So while you're in the process of wiping it up, you can use the thyme to get rid of it, but also stop it from defending itself. Most of the time, what I like to use rather than those products, if you have kind of a problematic area like that, like in the bathroom when I was staying, at a conference for Hawaii, I brought thyme essential oil and just put it on cotton balls and
Yep.
set it around the room that was humid, the bathroom.
Yep.
So then I'm not adding more water to the problem. But yeah, it was shocking. I was like, whoa, this grew mold really fast. So I'm gonna need to be doing some prevention. Yeah.
Good to know.
Yeah.
All right, so let's shift gears. Let's talk about
Yes.
mycotoxins and the immune system. So,
Yes.
more in relation to the theme of this podcast. So, when you have a chronic infection driven illness like Lyme, other vector borne diseases, long COVID, PANS, PANDAS, etc., how do mycotoxins specifically impact the immune system?
They're very tricky. So there's 3 different ways they can impact the immune system. They can actually, like, impair the genetics of your immune system so that you stop making smart antibodies. And what we see a lot with, like, Epstein-Barr virus, the whole herpes family, it's very common to have those be chronic and recurrent in people who are exposed to mold because they are, and a lot like Lyme too, they are particular microbes that rely on the immune system remembering so that when it sees it, it's like, oh, right, I know about you, and here's how we take care of you. Lyme is very important that way, that you don't like cure Lyme out of a body. Basically, the body puts it in jail. That's a good way to think of it. So any infections like that where we have to keep it in jail in our body, mold will change your immunity so those B cells, those memory cells, no longer remember the virus. So they have to refight it all over again like Groundhog Day. The other way is it's toxic to the actual immune cells themselves. So these eater cells, these macrophages, which are supposed to go out and like eat things that aren't good for us, they stop to function. So it won't even attach to that offender anymore. And it loses its ability to eat them, basically. And then just inflammation. It creates so much inflammation that it changes our ability epigenetically, which means around the genes, to say, hey, we would like you to express more anti inflammatory antibodies rather than inflammatory. It'll choose mast cells more prevalently than an antibody reaction. So it's a mess, So then what's the result? You're susceptible to stuff. You don't get rid of stuff once you get it. You have more inflammation, you have more mast cells, more histamine, and you have a wimpy immune system wired that way, which we can reverse all of that, by the way.
Yeah, definitely.
Yeah.
You just have to take the whole body approach.
Yes. Go
Yeah.
figure.
So I know you work with many patients or have worked with so many patients that have overlapping conditions.
Mhm.
How often were you seeing mycotoxin illness at the root of these complex chronic cases?
P boy, I would say it's in the above 80s%. I mean, it's been hidden. It's like you said, you don't smell it. There's no
Yeah.
sign, right? And it's also something that is really, kind of poo-pooed, of like, "Oh, come on."
Mhm.
It's so normalized, there's the word. Like,
Right.
an inspector who gets called into sick buildings all the time, so they have a selection bias, right? They have a bias of all homes are moldy.
Yep.
They will say things like that, like, "Oh, it's just Aspergillus and penicillium." They have a nickname for it because it's so common, Aspen. It's just a little Aspen. We see it all the time. That's not normal. Just because you see it all the time doesn't mean that's good. That's not healthy, you
Right.
know? So, yeah, we're building houses. This is a growing problem because of how we're building our buildings. We build the same building structure no matter where you live. So, if it's humid, if it's coastal, if it's dry, if it's, and there's crawl spaces. There are these building practices that are just problematic. And then HVAC, like there were a ton of furnaces and air conditioning units that got moldy on the inside because they added insulation right where the drip pan was. So it's just like this is a completely preventable problem. That's why we're doing our research is we're trying to get a lot of published research on human effects to change policy and to bring about regulation in not only in mold inspection and remediation, which both of those fields are really lacking in any kind of regulation, but also in building. Like, let's
Yeah.
stop building this problem.
Right. Right. Yeah, there should be certain specifications depending on the region and the
Yes.
environment. But, it's funny. I had a patient the other day whose inspector literally told her, "Oh, this is just normal house mold."
And how do you know
And
if
and
you
how
haven't
do I
tested?
come like, how you know what
Yeah.
I mean? When
Yep.
they did what you said. They did the dust test, they got the inspector comes out, and the inspector normalizes or poo-poos
Yes,
it,
they
you
do.
know?
Yeah. They don't even allow the people who are doing the big work, like my inspector, they don't even allow her to speak at these conferences anymore because who are the exhibitors? Insurance companies.
Wow. That's
So we're
crazy.
training inspectors to not find mold to save the insurance company's money. It's all a mess. It's a
It is
racket.
a mess.
Mhm.
It's kind of like the complex chronic illness sort of realm with functional medicine, right? It's like
Yes.
nobody's teaching doctors in medical school how to diagnose or treat any of this. So
Mhm.
now people are going out and specializing in it and spending a boatload more money on training and
Right.
certifications and understanding and then actually taking the time with the patient so they can no longer be part of the insurance model. So now
Right.
patients have to pay, 10 times more out of pocket to see one of these specialists to help them. And it's like, everything is being driven by like this monster machine of
Yes.
insurance and everything else. And wow, we could go down a huge rabbit hole right now, and I'm
Which
not
is
going to
why
lead us there.
which is
Um,
why we're doing what we are doing. We are out
right,
here educating, creating solutions and, so that people can that's the other thing, like, if you're listening to that and you feel like, then there's no hope, that is absolutely
not
wrong
true.
because now we have things like YouTube and we have podcasts and we have people who have been doing this, like you with your LimeCore products, you've been doing this for ages. You know what works, you know the combinations. Same thing with me with a light. It's just all all these solutions, we're making it easier for people to access it, and we're training more doctors. So
Right.
there's you can do a lot of this DIY.
You sure can.
Yeah.
So back to the complex chronic illness, let's say, Lyme, whether it's Lyme, it's long COVID, it's a child with PANS.
Mhm.
What are some of the biggest clues? Like if you had to say the top three clues that there's also mycotoxins in the mix, because so many of the symptoms overlap. Are there any like really big hallmark symptoms that would make you or should make someone else think mycotoxins are in the mix?
Yeah, it's almost more, an exclusion, which makes it hard. I mean, that's what we found in our research is that when you look at a pie chart of all of the symptoms, it was a very split up almost every symptom had an equal pie chart size. So it's like, what's the cardinal symptom? And that's what's hard about it. That's
Right.
so the questionnaire that I developed is a tool people can use. In our research, it is showing that if you have a 10 or above score, and this is based on our previous scoring, we're modifying it. But if you have a 10 or above on that questionnaire, it is a positive predictive value for multiple mycotoxins in your body. If
And
it's
so
Yeah,
I was going to say, where can listeners go to
yes.
do your questionnaire?
They can go to drkrista.com. It's on there in the handouts. So you can just get a downloadable PDF. If you want to be part of our study, you can go to moldiq.org and fill it out online. And then you get the PDF downloaded to you. And then we get that data that says, hey, but we need people who actually have mycotoxin testing within the month of the time they fill out the symptom questionnaire. Our whole goal right now is just validate the questionnaire. Are these symptoms correlated to these mycotoxins that were in that person's body the time we tested? So if you
And
just want to like test yourself, just go to my website. You can download it. And then you just fill out your score. And if it's a 10 or above, there's a very high risk that you have mold and mycotoxins. Whereas with Lyme, we do get that like the migration piece that is a little bit of a hint. Mold does not have the migration. So if that's part of your picture, I don't exclude mold, but I might say, I think we need to go down the MSIDS questionnaire route. Let's just see what your score is there. But if they have a 10 or above, I'm kind of like, yeah, I think mold is part of why you have migrating problems and you can't fight Lyme because you don't have an intact immune system. Respiratory problems are more common with mold than with Lyme, although if it's mycoplasma pneumonia,
Mhm.
which can also be a long hanger on, that could be mycoplasma, but sometimes mycotoxins are getting in the way of you fighting that off too. For most people, mycoplasma pneumonia is a non-event. It's more common to be asymptomatic. So it kind of depends on what symptom picture I'm looking at, and just remembering everybody reacts a little bit differently. And that's why I came up with the questionnaire because I'm impatient. It was crazy
Mhm.
making for me. I was like,
Right.
am I going to ask them to spend a bunch of money on a home inspector when I'm like, I think it might be mold, like that's not convincing enough. So yeah, that's why I created the questionnaire because way back we only had one way to test for mold. But now we have more things we can look at. I can talk about some of those things if that's helpful of like what are the
That was my next question. So,
lactic.
but just for all of the listeners, so if you do have mycotoxin illness, if you've tested and you are positive for mycotoxins, you can literally help to change the way of detecting this so you can help so many other people and even yourself in the future to save money on testing by being able to validate this questionnaire.
Yeah.
So please, if you have mycotoxin illness and you have a test, go on. It takes a couple of minutes to fill this out. And then literally you will be part of changing history and
Yeah.
changing the ability to use this test to detect and diagnose mycotoxin illness.
Yeah. Thank you. Yeah.
So,
We need the data.
absolutely. So, there's so much confusion about mold testing. So, what is your current go to approach for identifying mycotoxin illness, both in the patient but also in the environment?
Yeah. There is a lot of confusion about this. And I've done more split sample testing than anybody that I know on the planet, which means we take the same sample on the same day from the same patient and you send it out to multiple labs. And what I learned is that all the labs have value. So the question of what's your favorite test is not the right question. The right question is what is the best cluster for the patient in front of you to answer the question you're trying to answer? It's an exposure-based illness, determining whether they're being exposed right now is the most important question to answer. And that's a different way of looking at these tests versus like if we're later down the road saying, can I get off my treatment now? Are we fixed? Are we done? That's a
Right.
different cluster of things. So I try to do a cluster because there's no single test that can tell you have mold and mycotoxin illness all by itself. So the idea of I'm going to run one test and it's going to tell us everything is not a great expectation. Just like with Lyme, it's more complex than that.
Right. So
We
it's a
have
clinical diagnosis, and you're using the testing to support that clinical diagnosis.
exactly. And also to do a more precise treatment. I'm so excited at LymeBytes that I get to talk about these precision mycotoxin detoxification plans. Every mycotoxin is different. So I'm kind of doing people a disservice when I say mycotoxins,
Right.
umbrella.
Yeah.
Everything we've talked about on this podcast so far is how are they the same?
Right.
They're the same in a lot of ways, but they're not the same in how we get them out of the body. Some of them use the kidneys. Many of them use the kidneys preferentially versus the liver. Many of them will be pushed from the bloodstream into the gut to let the microbiome start chewing them up. So it's not always binders and,
Hmm.
ochratoxin doesn't respond to binders actually because the kidneys are the primary detoxification. So we want to also know from testing which mycotoxins are you dealing with. And that could be from looking at your home if you know what molds those are. We know the mycotoxins those molds make. Or we could test your body and look, but not everybody is a good excreter, and a lot of these tests are excretion based. So we want to put together a big picture. It's better to spend your money on good detection because it will shorten your treatment plan and the amount of money you have to spend on treatment. So I love a good detection. So what am I looking at for a cluster? I'm looking at a visual contrast sensitivity test. That's vcstest.com is my favorite. If that's bad, there's a chance that you're exposed to mold right now. I look at a urine MPA, which is mycophenolic acid. This isn't a mycotoxin, and why is that important? Remember, we talked about in the beginning, molds, if it's actively living, will be off-gassing these chemicals, but not necessarily making mycotoxins. So if your MPA is high, there's a high chance you're in actively living mold right now. And that is easy to excrete through the urine for most people because it's water soluble, it's different. I also look at a MyMycoLab antibodies to mycotoxin of the IgE. If the IgE is high, that means you've been exposed to an appreciable degree to mycotoxins in previous 2 weeks. And then a mold allergy. No one should be allergic to mold. No one should be allergic to mold. If you are, your cup for handling spores is flowing over. Why is your cup full? So I
Because
look
of
at those
frequency of
four.
exposure, right?
Exactly.
Yeah.
So I look at those four things, and if three of the four are positive, then I feel very confident, and you have a bad questionnaire score, I feel very confident saying, okay, now we need to invest the money on building investigation and removal.
Okay.
Because
That makes
that's
a lot
the,
of sense.
yeah, yeah. But, which question are you trying to answer? That's got to dictate it. And then there are little nuances there of, with like a pans kid, they don't make great antibodies anyway, so why would we do an antibody test with them? So, there are other nuances, and that's what I go into in the trainings in my updates course. Yeah.
Okay, so for everyone listening, you're going to have to, if you want more information, go to drcrista.com,
Mhm.
correct?
Yep, DRCRISTA. Yep.
Okay. And then on there, there's the 10-hour basic course, but then there's also a 3-hour course that has all of the updates.
Mhm.
You can come to the LymeBytes Symposium in person November 14th and 15th, or join us virtually online. She's going to do a very in depth presentation specifically on each mycotoxin and how to clear them out of the body, along with a whole bunch of other very valuable information on mycotoxin illness. But before we close, only for the sake of time, because Jill, I could talk to you seriously all
I
day
know.
long, but I
You
just
do.
realized how long we've been going. Walk us through, leave us with your key pillars for healing from mycotoxin illness.
Yes. Bioflavonoids before binders.
Hmm.
Since most of them go out the kidneys, they need bioflavonoids to be released from a blood protein so the kidneys can flush them out. So bioflavonoids before binders. For binding, I really like to use aloe. It's like charcoal and clay, but it gives back. Aloe you can take with food. You actually should take it with food. And it helps you bring in more nutrients, but it's also a binder. And the reason I love it is it's a potent antihistamine. It's a potent mast cell stabilizer. So a lot of people are dealing with these weird food sensitivities and they're like, what in the world? I can't eat anything. And aloe also will increase your immunity. It's an immune modulator. So it's just a really simple, elegant binder. So the bioflavonoids, a little aloe, then you can do some detox. And then I use antifungals, both in the body and in the nose. I preferentially choose plants if I can.
Mm-hmm.
And that has to be around for a long time. That might be 6 months that you're doing something antifungal. But boy, when we add the antifungals, people get that. That's when they really turn the corner. They're like, oh, I feel like something just lifted. Yeah.
Right. And there's a very important order. This isn't
Yes.
all at once. It's strategically, right? Get yourself
Yep.
out of your moldy environment, then get on the bioflavonoids. And give me your top 2 favorite bioflavonoids.
Yeah, I love, of course, because I'm making it, one called Color Guard from Alight
Yeah.
Health. It
Yeah.
has every band of the rainbow of a bioflavonoid that is specific to pulling out specific mycotoxins. So it's all made for mycotoxin detox through the kidneys. Also quercetin. A
Yeah.
lot of people just don't think about it's a it's not just for allergies, guys,
Oh,
but it is for allergies. So it helps with
right.
that mold allergy piece. There's tons of information about how it's cell protective, it's protecting the liver, that kind of thing. And green tea, you can add
Yeah.
green tea very easily to your diet.
Yeah.
So those are just some really easy detox things.
Okay, so number 2. Number 3, we have binders. It sounds like aloe is
Mhm.
one of your favorites, so I'll leave it at that. And then I know
Yes.
you love food binders too. So
Yes.
ground chia seeds, ground flax meal, things like that. And
Yep.
then number 4, antifungals.
Mm.
So let us know your top 2 favorite systemic antifungals, and then if you have a favorite nasal spray. And let's stick with the
Yes.
natural ones for this
Yeah, yeah. Yeah.
episode.
I mean, it's oregano oil. It's so easy, and if you're a real sensitive person, you can get it in a liquid and just do drop doses
Yeah.
of it. So that's why we love tinctures. Yes, it can be so easy.
Hmm.
And clove is also very good antifungal. It's soothing to the gut, and so I think, especially if you're a sensitive person, start with those and start low and slow and just creep up. For the nose, I love one called Nature and Nectar's Nasal Guardian. It's propolis.
Oh,
And propolis is a fabulous antifungal. It's antihistamine. It's anti-COVID,
hmm,
coronavirus. Yeah. So it's got a lot. It's kind of like this big, broad spectrum activity, and it's just lovely.
wonderful. Thank you for sharing those tips.
Yeah.
All right. So before we end, any parting words of advice for our listeners?
If you are going to test yourself in the urine, please get my test prep handout. It's free on my website. It's down in the handouts portion in the footer. What you eat can come out in your urine. So we want to make sure that we are minimizing the challenge or the limitation of that test. So let's make sure that whatever's coming out in your pee is actually from your body. So yeah, that would be it. I want to make sure people are getting, if you're spending your money on this test, let's make
Right.
sure it's good
You want
sample.
accurate results.
Yes.
Okay.
Yes.
All right. So if you want to hear more from Dr. Krista on how to heal from mycotoxin illness, join us at the LymeBytes Symposium November 14th and 15th at the Pompano Beach Marriott, or join us online virtually. Thanks for listening to LymeBytes. We hope this brought you one step closer to true healing. If it helped you, share it with someone who needs to hear this too, because together we heal stronger. If this episode gave you an answer, brought you new insight, or made you think differently, subscribe to the LymeBytes podcast and share with someone who's ready to take control of their healing journey. And if you can, please leave a review. It helps others to find the show. Thanks for listening, and we'll see you next time.